Hello, everyone. It's Thursday, April the 30th. I'm sure I can speak for lots and lots of great West Virginians and to say that, in a lot of ways, I'm going to be glad for April to get gone. And I sure think, we could go back to March as well. But, today, I've got to announce again that we lost another West Virginian. We lost an 89-year-old man in Jackson County, our 41st death. I sure wish to goodness that we'd stop this because, I hate like crazy every time I have to announce that we've lost another great West Virginian. And so if you'll please keep them in your hearts and your prayers. And the other thing is just think about their loved ones and all their friends and family. And like I said, please keep them in your thoughts and your prayers. I'm going to read a little bit to you today, and then I'm going to talk to you as well. But today is the official first day of our West Virginia Strong, our comeback, the comeback in West Virginia. So we're bridging today to something that is somewhat new and somewhat old, and in an effort to try to take the miracle that we've already done within West Virginia and duplicate the miracle again. Today marks the beginning of week 1. And Monday will mark beginning of week 2, and then the Mondays thereafter will be 3, 4, 5, 6, whatever. Again, we are allowing people to open, but we're not requiring people to open. We want you to use your best judgment, follow the advice of your boards or whomever it may be. But absolutely, as we reopen, we want to reopen safely as can possibly be. Now, if I could read to you just a few lines here, week 2 will begin this coming Monday. On Monday, May the 4th, I will officially lift the stay-at-home order and replace it with a new, safer at-home order. And that order will look like this. You can show it up on the screen now, Jordan, if you would, please. But this will be our new, safer at-home order. And we got the wrong slide, but this order will have a lot of information, a lot of guidelines, and we've got some technical difficulties, so I'm just going to keep on going. We'll get that up in just a second. The order goes into effect at 12:01 on Monday, 12:01 a.m. on Monday. It will be released today in preparation for next week. The order strongly encourages all West Virginians to remain at home, but no longer orders them to stay at home. By tomorrow, we will have further guidance for our 5 hotspot counties. Now we've got it up on the screen. Again, I encourage all businesses that are allowed to open to do so only if they follow the guidelines to keep West Virginians safe. We continue to work with our business groups to help them establish protocols. You should continue to stay home if you have any symptoms whatsoever of COVID-19 or have come in contact with someone who has. So, the bottom line is this will go into effect at 12:01 a.m. on Monday, and it is our safer at home. It has many different guidelines and everything, as you'll see, and it'll be up on our website right after this today. Now, let me just point out 2 or 3 things real quick. Okay? First of all, we have some feedback, that people want to know more about the counties themselves. They know all the different stuff we've done with the nursing homes in different places and how proactive we were in getting all the, in making all the nursing homes be tested and all that. They know that. They're happy about that, but they still want to know more about their individual counties. And I can promise you just this, that our people are watching your individual counties every single day. And we'll try to start pumping out more information on all the counties as we go forward, and our experts are working that up right now. Now, another thing that's come up is, our cumulative average, if we could put that other graph on, the one we had on just a second ago, our cumulative average is now trending at 2.51%. Now, that's not on this graph right here, but I'm just talking to you. Our cumulative average is trending at 2.51, which is better. But what this graph shows is all the way back to, I think, the March the 30th, and it shows our curve, or how we have trended since March the 30th all the way till today. Actually, it was through yesterday. Now, you may not be able to see this, on your screen right now, but if I could just read to you the last 5 days, because this is not a cumulative chart. This is a chart day by day of positives versus tests. In the last 5 days, we have trended on April the 25th, we trended at 1.5%. On the 26th, we trended at 2.7. On the 27th, we trended at 2.3. On the 28th, we trended at 1.7. And on the 29th, we trended at 1.3. So we have been, now we've got 3 out of the last 5 days, we've been in the 1%. So that's great. That's exactly what we want to see, and that's really great. That's not cumulative. That is absolutely just day by day. And really and truly, even though we are going to move forward on the cumulative number, we are absolutely tracking each day. And as we track each day, then our health experts and our people from our guard and everything else will know if we got a problem. And that's why I said over and over, as we know we have a problem, then we run to the fire. And we don't do it shooting from the hip. We do it scientifically and mathematically and absolutely with our experts right behind us. And that's why West Virginia, strong, the comeback, we hope and pray will work. Now, Jordan, if you want to come back to me, I'm going to go through these other things pretty quickly here. And, in week 3, businesses will be allowed to open in week 3, and we will be announcing how we'll move forward in week 3 on Monday. I caution everybody, I just continue to do the same thing over and over, but you've got to know the elderly, just like the gentleman we lost today or yesterday, the 89-year-old man, the elderly are the target. But yet the young can transmit it to the elderly, and the young may not even be sick. So I caution you over and over and over to be as safe as you possibly can, to use all the guidelines we've already done. Show me just how great you are, West Virginia, in every way. Now, absolutely, as we bridge to this other stage, and we've got to know, and I have told you over and over and over, this disease is here today. And we've got to learn how to live with it until we get a medicine that will take this disease out of our lives. And so as we move forward, know it's still here. And we've got to be safe, and we've got to protect, and we've got to do the smart stuff that we've already done. Now, DHHR will be releasing updated guidance on daycares, on all the daycares today. In regard to horse racing, on May the 14th, we will start spectatorless, without people, horse racing only, that will be able to resume at that time. Now, it takes a couple of weeks of training, active training and conditioning before it's safe for the horses. So they will be starting back very, very soon in preparation for us to have spectatorless horse racing beginning on May the 14th. Now, something that's really dear to my heart is just this. We've got people in this state that are hungry. And we're trying every way in the world to feed our kids and our elderly and those that are, surely less fortunate, but maybe having a really tough time. I mean, for crying out loud, West Virginians know that we absolutely, surely to goodness, have to take care of people that are really having a tough go. Everything in the world biblically tells us just to do this. And that's why West Virginians are so great and so dear to my heart. But there's a drive now with the United Ways of West Virginia. They're calling it Country Roads Food Drive. And West Virginians have really stepped up like they always do during this pandemic to help one another. The United Ways of West Virginia are holding a Country Roads Food Drive on May 5th, 2020, to feed families in West Virginia during this COVID-19 pandemic. I encourage you, if you would, to try to help, to try to call in to these people, and to try to do any and everything you possibly can. It's great stuff. It's great stuff where you see over and over and over West Virginians stepping up and doing all the good stuff that they do every day. Now, I've encouraged you over and over and over about the census, and I've asked you as West Virginians, if you would please, to call your neighbors, your in-laws, your outlaws, call everybody around you, and absolutely make sure that we get counted. Last thing I'd report to you is just this. The percentage of tests to positive, I just said earlier, in West Virginia is 2.51. The next closest state to us, Virginia, PA, Ohio, Maryland, and Kentucky, is Kentucky at 8.35. More than 3 times higher as far as their trend line of percentage of tests to positive, more than 3 times higher than us. The national average is at 17.13, almost 6 times or 5 times higher than us. And all the other states, Virginia, 17.28, Pennsylvania, 20.65, Ohio, 13.42, and Maryland, 18.79. And here West Virginia sits at 2.15. How? And it's so simple. The how is so simple. Your leaders could have come up with every right play. But if you West Virginians didn't run the plays, we couldn't be here. And so really and truly, you're doing an incredible job. Please keep everybody safe. Please use your head. Please absolutely use all the guidelines that we are pumping out to you like crazy. And please, more than anything, look after the elderly, and let's just continue this whole trend, and let's just continue to win as West Virginians have done so often. I'm really proud of you. Thank you.
All right, thank you, Governor. We're now going to take comments from a few of our panel members. Up first, we have Dr. Clay Marsh, our coronavirus czar.
Well, thank you, Governor, and it's great to be with everybody today. I'll make my comments pretty brief. I think the governor has very nicely demonstrated that, the cumulative number is certainly one that's a good one for everybody to keep their eye on. But certainly we are looking at a lot of different metrics to advise the governor on the safety during this reopening, both at the state level and also at the county level. I want to add one more metric that we're watching very closely, which is the R naught, that R sub-zero. And that is a reflection of how many new people will likely be infected by a single infected person. And ordinarily, the virus will infect 2.5 people to up to 6 people. But in West Virginia, as one of the lowest places in the country, we're at 0.73. So as long as that number is below 1, and the more below 1 it is, it suggests that we have really slowed down the spread of the virus. And that is a really, really important protective factor, and one that we will follow very closely. The other thing to know is that yesterday and today were the first days where our active cases versus our recovered cases and some of the folks that have died started to cross over. So we're now seeing more people recovering than we are seeing people that are newly active. And obviously, that's a metric that we need to follow as well. My last comment, which really goes to what the governor said at the end, is that the single most important thing for us as we go forward during this new part of the process of reopening, or as Thomas Puyo called the dance, where we're coming back out learning to live with the virus, is that we really have been successful because of you, because of the activities and the personal responsibilities you have taken. And that means that, as the governor said, if you can stay inside, do. If you can work from home, do. If you go outside, keep that good distance, 6 feet, but also wear a face covering, wear a mask, make a mask, help your neighbor to do that. A dish towel will even be helpful, or a washcloth, because we know if 60% of our citizens wear a mask that's 60% effective, which basically means you can't see through it. If you can see your face through the mask, probably not good enough. But if we do that, we reduce the spread of the COVID virus even more. And that's because that mask, that barrier, not only protects you if you haven't been infected from getting infected and keeps you from putting your hands around your mouth or your nose, but also importantly, it keeps those 70% of people or so who either don't know they have an infection or don't have symptoms yet from spreading it to other people. And we've posted some pictures, some videos on social media, on Twitter, but you can see the real difference in that spread, that spray. And we know now that people can communicate COVID by singing, by talking loudly, by coughing, by sneezing. So if we can start to identify face coverings, and we help our neighbors out if people don't have access to them, and we can help direct people. But that's going to make a huge difference for the state of West Virginia as we come back out together and allow us to keep all these numbers low and get back to our personal freedoms. And don't forget to wash your hands really well as well. So thank you.
All right, thank you, Dr. Marsh. Next, we'll go to Secretary Bill Crouch with the West Virginia DHHR.
Good afternoon, everyone. I have several things to cover. Let me first talk about the nursing home testing efforts for our vulnerable elderly population in the state. We are at 97% complete in terms of the facilities tested. We have 96% of those tests in. We have only 4 facilities that have not been tested. 3 of those are being tested today and 1 tomorrow to complete that effort. I will give a better report tomorrow in terms of the results of that testing. I also want to mention a payment. Our Bureau of Children and Families is issuing a one-time $100 payment to both LEAP participants and heating source vendors in an effort to offset bulk fuel expenses from the current program year. LEAP is a program called Low Income Energy Assistance Program, and that should be on the screen. Individuals do not need to apply. This is automatic, and a payment should be received by the end of May. This is another effort that DHHR is trying to help West Virginia's low-income families offset additional costs during the COVID-19 pandemic. The governor mentioned child care worker testing. The governor directed that be done for all child care workers in the state. We have provided information to those agencies that employ child care workers. We currently have 680 child care centers that are operational to take care of essential employees' children. So those individuals can also be tested, those workers. Please contact your child care agency supervisor or director with regard to testing. The testing is available at no charge to provider or employee, whether or not the individual is insured. It's covered by the individual's medical insurance or Medicaid if the individual has no insurance. By federal law, there can be no charge or copay to individuals being tested for COVID-19. The National Guard is on standby to assist in any testing. Individuals should check with their employers, or the local health department is helping to coordinate that effort. So we want to make sure everyone gets tested. Let me finally talk about a minute about the governor has directed us to add to our website information on our African American community as another vulnerable group in the state that we're going to provide some focus and some information on. Our dashboard will begin to include the location of individuals, number of positive cases, number of deaths in the African American community. So we were working hard to try to get that information up, I believe, by Monday. We will also be developing an advisory group that can assist us in providing accurate information and timely information. So that's all I have. Thank you very much.
Thank you, Secretary. Next, we'll go to Major General Hoyer with the West Virginia National Guard.
Good afternoon. As we get into the next phase of our initiatives and the comeback phase, Governor has tasked the National Guard with an additional mission of providing support to the various sectors related to best practices as we begin to phase in opening up various sectors. I want to highlight a couple of areas today. Later today on the National Guard website, as well as the governor's site, will be published and posted a document that was developed by the West Virginia National Guard and the National Federation of Independent Businesses and local representatives of that organization from West Virginia, a set of best practices to be used by small businesses as they move forward. In addition to that, if a business has a question, we are available to provide support going forward. We request you look at working through your local emergency management or health department, or coming through the appropriate associations within your sector to reach out to us for support. In addition to that, today we are working at 2 facilities, one long-term care facility, one independent and assisted living facility, working on pilot projects to develop more best practices for those facilities going forward. And yesterday we received back testing data from a test that was done where the National Guard used a hydrogen peroxide vapor machine to sanitize an HVAC system, and then tested with the appropriate biomarkers to ensure that it worked effectively. That test did work effectively, and we'll be rolling that out to support various organizations and entities going forward. I would also like today to thank Commissioner Betsy Jividen, Commissioner of Corrections, Paul Simmons, and Betty Slack from Corrections for the great assistance the Guard is receiving from corrections and prison industries relating to the development of PPE for our efforts going forward. And last thing, as the governor pointed out, we've got a significant focus at his direction on feeding and caring for our children, our elderly, and our families that are in need right now. And just to give you a benchmark, for the month of April, one food bank, Mountaineer Food Bank, distributed 1.7 million pounds of food to individuals. Our food banks are doing a great job, along with VOAD and all the various organizations that are supporting. And on behalf of the governor and the National Guard, we thank all those who continue to provide support to our food banks and all of our efforts to feed those in need. Thank you.
Thank you, General. Once again, we're holding today's briefing with media members joining us virtually to practice good social distancing. The first questioner we have today is Mark Curtis with Nexstar Media.
Good afternoon, everyone. Mark Curtis, 13 News, Next Star Media Group. I've been contacted by a number of churches and places of worship, and they're asking for some clarity on their guidelines because I believe you put a limit on 25 people at any one gathering. And what these churches have asked me is, could they possibly have 25 people in their sanctuary, then maybe another 25 people in their fellowship hall watching via television, or 25 other people in the basement watching, as long as the groups are spread apart and do not exceed 25 people? Is that something that would be allowable, or are they, pressing their luck putting that many people in one building?
Okay, Mark. The churches, we've got to make sure that everybody understands this. The 25 guideline is not for churches. It's for gatherings, but is not for churches. And the church's guidelines are all published on our website right now. But absolutely, we want our churches to understand that we can't restrict our churches to 25 people or put 25 people in the basement or whatever. We don't want them doing that. We've got guidelines of how they can go and how they can have, really wonderful worship with their families and stay a pew apart and stay with their families and wear masks. And all those guidelines are on our website and everything. And I understand how they could pick up on the 25 and it be misunderstood and everything, but that does not apply to our churches. And we want our churches to rejoice and understand just what we have on our website, and that'd be great.
All right, thank you, Mark. Next, we'll go to Kara Lofton with West Virginia Public Broadcasting.
Hi, Kara Lofton with West Virginia Public Broadcasting. So this is probably for Dr. Marsh. When we're looking at the data, we have tested about 2.3% of West Virginia's population. Can you define for me what is meant by comprehensive testing? And is that sufficient when we look at sort of the risk of a second surge in terms of reopening and this process of reopening?
Governor, you want me to handle that?
No, yes, sir. She asked you, sir. Please.
Okay, sounds good. Kara, thank you for the question. So, we have, I think, dramatically increased our testing, and as we have heard repeatedly, we, on a per capita basis, are almost double the national average. But I think you're exactly correct. We plan to extend testing much more dramatically, but we need to do it more systematically. And as we've said before, we're really trying to focus on our vulnerable populations and congregate populations, because these are the populations that have the highest risk of being hospitalized or dying of COVID-19, or of spreading COVID-19 very rapidly. And then we want to turn to to not only other vulnerable communities, but parts of the state with much more activity. So my hope is over time, we will test, hundreds of thousands of the state's population and reserve testing as well for population outbreaks, clusters that we see as we do the dance. So we are really at the front side of our testing. And as we continue to expand our testing, we believe that we will see a much better picture of what's really going on in West Virginia, including identifying some of the non-symptomatic or undiagnosed people that can spread. Now, the last thing I will say is, and I said this yesterday, so Thomas Puyo, who's a guy who I've followed and very much appreciate his view of things, who's an engineer and presents data, he points out that in the world, the countries that do the very best job of tracing and tracking and responding quickly are the countries where the rate of positive cases is less than 3%. So we're really in that window, and we want to continue to expand testing. But we believe at this rate of positivity, we have a great advantage because we will be able to see much more clearly outbreaks as they happen rapidly.
All right, thank you, Kara. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, I was wondering if you could give us an update about the processing of the unemployment claims for our self-employed, the gig workers, those folks. I know you said we've gotten 10,000 in when it initially opened on Friday night. How many have we received as of now, and where are we at with getting those processed? Thanks, sir.
Charles, there's parts of this that I don't know, but we have received in excess of 13,000 at this point in time, and our people are working them, and I don't know exactly. I don't have an update from Scott, as exactly where we are, but we're having. The process is a little bit labored from the standpoint that we're having to vet, differences, in the W-2s or whatever it may be. And so that's about as far as I can take it. We got 13,000 and going through the process of vetting and working on the W-2s and all that kind of stuff that we're doing. We've just never done it before. I mean, that's just all there is to it. And our people are processing as fast as they can, but they've just never done this before.
All right, thank you, Charles. We'll go to Amanda Barron next with WSAZ.
Hi there, Amanda Barron with WSAZ. I know you gave the update, Secretary Crouch, about the nursing homes. I wanted to ask more about who's being allowed to be admitted into nursing homes right now, and the rehab facilities that happen to be in the same buildings. Also, is there an update on the investigation into the situation that you all talked about in Jackson County?
Yeah.
Bill, this is
Governor.
you.
All right. Yes, Amanda, thank you. The first question in terms of the nursing home population, that will be completed tomorrow, and I'll give a report on that. And I'm not sure if I couldn't hear all of your question on the first part of that. Can you repeat that one more time, please?
Sure. How are people being admitted to nursing homes right now? Is there specific criteria that people who might be a new resident, are they being tested for COVID-19? How are you protecting that population from anyone who would potentially be a new resident? And then an update on the situation in Jackson County.
Yes. Okay. Thank you, Amanda. That is an issue we're exploring right now. Nursing homes are very reluctant to take patients back from hospitals that have been admitted to hospitals, sometimes for other reasons, not necessarily for potential COVID testing. So we're working with nursing homes. Many are becoming more comfortable with that and are beginning to take patients back. We have some hospitals that have patients that are really nursing home patients, and we're working hard the last 2 days to try to resolve that. So nursing home population is very low now. You'll see with the final numbers on the testing that they weren't as high as we thought, and that's because census is down in the nursing homes. In terms of the Jackson County, that is due by the end of the week. I will be able to provide a report on that. We are not, we cannot provide any information until that report is complete according to CMS guidelines. So, but we'll provide that information to you as soon as possible. The nursing home actually has an opportunity to respond to that and write a plan of correction before that information is published, and then it is published on the website. So I will be happy to provide information on when that will be available.
All right, thank you, Amanda. Next, we'll go to Brad Mcelhenney with West Virginia Metro News.
Hi, Governor. Hi, everybody.
Hey,
we all have to make solid individual decisions now and in the near future. So I was wondering if you all wear face masks when you go out, for example, to get takeout from Applebee's or Wendy's or wherever you might go.
Brad, that's a tough one on me because I'm probably not doing as good a job at that as I should. But you know, the one thing that I'm not doing is if I were to go out of the vehicle myself, I would have a mask on if I were to go into a, you know, Walmart or you know, wherever it may be, a convenience store or whatever. But I just don't do that, you know. So the only thing that the only thing, I'm not wearing a mask in the car, and I'm not wearing a mask walking back from here back and forth to the mansion or whatever. But other than that, you know, I don't go outside, you know, from the standpoint of going into a crowded situation or going into a store that I wouldn't wear a mask. I've got 2 masks in my little console, and I would have a mask on if I went in.
All right, thank you, Brad.
Governor, this is General Hoyer. I just wanted to let Brad know that I had to go have a medical procedure done yesterday, and I had a mask on. My wife went to the store this morning, and she had a mask on. So the Hoyer family are following the governor's guidelines related to wearing masks in public.
Well, and let me say one other thing too. I do, recall that probably about maybe 6 days ago, I was around a small crowd of people at one of our manufacturing facilities, and I had a mask on there. So
This Bill Crouch, Brad, I think that's a great question. I don't get out much anymore, it seems like, but I did stop and get gas yesterday and went inside, and I had my mask on when I went inside. Great question.
All right, thank you, Brad. Next, we'll go to Kenny Bass with WCHS.
Governor, I have a question about sporting events and gatherings. Those, along with movie theaters and concerts, are not on your schedule yet when you go through your first 3 to 6 weeks. But horse racing with no fans has made it onto the list and will be open on May 14th. Where are we with sporting events in West Virginia? Where are we with concerts? Where are we with movie theaters? Some will have the ability to actually reserve seats and ensure safe spacing. When are you going to look at those industries? Because obviously, while recreation is not as important as businesses, it's still an important part of many West Virginians' lives.
Surely, Kenny, I get it. I get it wholeheartedly, and we're just going to continue to expand as we watch the numbers. That's just always we're trying to do the very best we possibly can. And we're just going to continue to watch the numbers and bring you more and more back to normalcy, as fast as we possibly can. And before I go any further, let me just say this. I may have been wrong, just a second ago, because I'm trying to recall exactly where I was and everything when I had the mask on and everything. But I was when I got out of the vehicle, wherever it was, I did put the mask on.
All right, thank you, Kenny. Next, we'll go to Phil Kabler with the Charleston Gazette-Mail.
Governor, regarding reopening the state, of course, tourism is an important part of the economy here. Are there plans to, what are the plans to reopen the tourism industry, and particularly since that puts us at risk of having individuals from states with high infection rates coming to West Virginia?
Phil, yesterday I met with, Chelsea Ruby. Chelsea had a lot of great ideas. She's done an outstanding job, and we looked at all kinds of things, from, the ATVs to the whitewater rafting to just all kinds of different things that are out there and everything. And we will have to do exactly what I've said over and over. We just got to continue to watch these numbers and take baby steps before we try to run or walk. And as we just keep going forward, we'll just be smarter and smarter about what we're trying to do. But you're exactly right. When you open up activities and everything, people can come from out of state, and then we have, some level of more exposure maybe, but we just got to continue just to watch and be on guard and be ready to stop a problem, because we know there's going to be problems. There's problems, and that's what everybody's got to understand. There's gigantic problems with doing nothing. And if we do nothing and we stay at home, we're going to have a lot of problems there as well. And so we've got to try to go back to doing what we, West Virginians are great at doing. And so as that, we're going to just go slow, and we're going to go smart, and we're going to be ready to attack a problem if we end up with a problem.
All right, thank you, Phil. Next, we'll go to Taylor Stuck with the Herald-Dispatch.
Hi, this is Taylor at the Herald-Dispatch. I know we have guidelines and we've talked a little bit about that, you know, if you see a problem, call your county health department. But these restrictions on capacity in establishments and businesses, is that on the business to make sure that only 5 people are inside the gas station, or is that on the customer to kind of figure out if they feel good going in? I've gone a handful of places and I'm a little unsure.
You help me with this, this question, I can tell you we're on the honor system from the standpoint of the business owners. The guidelines are out, as far as the number of people that are going to be allowed in the business and everything and how they're allowed from the standpoint. We want people, to wear masks at all times if we possibly can. We want to have people taking temperatures, all the different stuff. But Bill, maybe you could help me out with a little bit with that too. Sir.
Yes, those guidelines were developed in a scientific way, looking at to make sure that that individuals in a certain size building could safely social distance and keep apart from each other. So, but as the governor said, it's the honor system. It's a guideline to provide the businesses and the public information so that they can be safer out there. As the governor said, as I said many times, this has been successful because West Virginians are smart and have paid attention to what they need to do. So this is another way to help them determine what works and what doesn't work. So we will provide any additional assistance that we can out there.
And let me jump back and just say this too. Everyone surely ought to know by now, because you've watched me over the last 60 plus days. And over those days, you've seen Jim and Jimmy and James, and if need be, and we can't trust people on the honor system and everything to do what's right, we will intervene. That's just all there is to it, because we're going to make sure, to the very best of our ability, that people abide by the guidelines as we're trying to help and get us back to work.
All right, thank you, Taylor. We have time for one more question. We'll go to Jackie Swigart with WVVA.
Hey, all. Jackie from WVVA here. We're getting questions from concerned citizens who are in a high-risk category, worried about going back to work once their place of employment reopens. Are there different guidelines or exceptions for businesses who employ seniors and those who are immunocompromised?
Okay. Can Bill or General, can y'all jump in, or Clay?
Certainly, Governor. As the governor's mentioned before, we've been successful because everyone takes care of themselves and their families. We've had such great success with West Virginians who are doing the right thing, who are making the right decisions. If you have an elderly person who is at high risk, our suggestion is that they stay home. As the governor said earlier, even workers who can telework should continue to telework. So those decisions are individual decisions that need to be made sometimes, and we just want people to continue to be smart. If you are a high-risk individual and you're susceptible to being a high-risk individual and having this virus, please stay home, take care of yourself, be safe, and keep your family safe.
All right, Governor, I'll turn it back to you.
Okay, thanks everybody, and a special thanks to our experts and everything you see, whether it be Secretary Krause or, Dr. Slimp wasn't with us today, but herself and our great General Hoyer or our great Clay Marsh, the job that they're doing is unbelievable. And all the disciples underneath them, unbelievable. And that you see it by their ability to grasp what's going on, and I hope you see it in their words. So I can't thank them enough, as they've given me wonderful guidance, and I've been able to follow suit. I'm always really, really hung up on the truth, and that's why I wanted to go back to, and to where, I'm trying, well, not I'm trying, I'm doing, if I'm outside of this environment right here, I'm in a vehicle. And if I'm outside of my vehicle, I'm in the house. And if I'm outside of my vehicle and I'm going into a store or whatever like that, I'm going to wear a mask. And I would tell you to do exactly the same. I can say that, that if you just think of the monumental task that I put on these people, I said, we're going to test all of our nursing homes. First state in the country to do that and everything. And to do that, it was almost doubling the whole number of tests that we had done in the previous 40 or 50 days. And they had to scramble. And I mean really scramble. And I said I wanted to get it done in a week. Well, I knew that was impossible for all practical purposes. But in a little over a week, they have now tested 97% of the nursing homes, and with 96%, I think is what Secretary Krause said, of the tests that are now in. And again, all I can do is hats off to Secretary Krause and Dr. Schlemp and General Hoyer and Dr. Marsh. Great, great, great work, guys. And the next step beyond that is just this, is we're going to now be expanding that testing, to all kinds of different areas, whether it be the African American community, it be the assisted living, it be our corrections, whatever, daycare, and we just go and continue to go and go and go. I again salute, it's the thing super dear to my heart is just this is, to be able to feed our people. I think General Hoyer said that one of our food banks, Mountaineer Food Bank, has delivered 1.7 million pounds of food. Are you kidding me? It's unbelievable what is really happening, and it's happening right in front of us, and I couldn't be more proud. And I just want to end by just saying this to you. Just remember this, because you'll remember this. Way back when, probably in the very, very, very late days of February or the early days of March, I came to you and I said, it's not time to panic. It's time to be cautious. It's not time to be fearful. It's time to be smart. It's not time to be weak. It's time to be West Virginia strong. Do you remember me saying that to you? And I said that to you in the early days of March, and look what you've done. Just look what you've done. You have absolutely not panicked. You have absolutely been cautious. You've not been fearful. You've been smart. You've not been weak. You've been West Virginia strong. You've led the nation. I could not be more proud. Now let's just keep it up. God bless all of you.